Hi, my name is Maggie, and I'm going to be discussing mental health. So, what is mental health? Well, it's a very broad topic, and generally, it's any mental illness that an older person may experience. We may not realize how prevalent mental health issues are in the elderly, but they're very common, especially in those with chronic illnesses. An academic journal that I researched explained that 20% of the world's elderly population suffer from mental illness. And the book also says that nearly 20% of the older adults in the United States with dementia experience mental health disorders, such as depression. The most common mental health disorders, according to Sivakumar and others, are depression, dementia, and delirium. Some others that are mentioned by the book are anxiety, severe cognitive impairment, mood disorders, alcohol and substance abuse, post traumatic stress disorder, schizophrenia, and psychotic disorders. All these mental health issues are often overlooked as just a normal part of aging, but they are not normal parts of aging. Transitioning to the changes in mental health in the geriatric population, the book explains that mental health is no different in later life. There are just greater challenges in overcoming it. The biggest difference is the presence of neurocognitive disorders like dementia. This is an irreversible cognitive disorder that affects physiological functioning, social life, and activities of daily living. The presence and progression of mental health issues correlates to many factors surrounding the life of the older adult, but physical health plays a key and major role in the development of mental health issues. For example, the loss of independence due to aging and not being able to take care of yourself can trigger mental health issues. And to further elaborate, there are varying degrees of mental health issues, and oftentimes the mental health gets worse as the person's physical or chronic conditions progress, including the issue of dementia. Chang and Chen explain that 90% of patients with dementia exhibit depression, delusions, hallucinations, and sleep disturbances. So, although mental health is clearly an issue in older populations, the book explains this idea of ageism that affects identification and treatment of mental health disorders in older people. Anxiety and depression are two very common mental health disorders of the geriatric population. Anxiety is just unpleasant and unwarranted feelings of apprehension, and depression is a very serious mood disorder that affects daily life. Now, it's hard to explain these two mental health disorders through their pathophysiology because there are many factors that contribute to the development of these disorders, and those can include chemical imbalances of the brain, specific life circumstances such as retirement, changes in their independence, or even the loss of a loved one, and also the diagnosis of chronic physical diseases. Some signs and symptoms of anxiety are being startled easily, having fear, worry, panic, and then also shaking and numbness and tingling. And then some of depression could be restlessness, irritability, moodiness, emptiness, hopelessness, and then sleeping more than normal, memory problems, agitated behavior, or changes in appetite resulting in unplanned weight loss or weight gain. Another type of mental disorder that goes under the umbrella of mental health is dementia. Now, dementia is very unique to the geriatric population because it typically only occurs in older adults, but this is not a normal part of aging. It's just simply a group of symptoms that affects memory, thinking, and social abilities severely enough to interfere with daily life. Now, this is characterized in the clinical setting as a loss of neurological functioning, like the inability to perform activities of daily living. And pathologically, it is the loss of neurons accompanied by Lewy bodies or Alzheimer's plaques. that are examined in the brain tissue postmortem. Some signs and symptoms could be cognitive, like memory loss or difficulty handling tasks, or just general confusion and disorientation, and then also personality changes, inappropriate behavior, agitation, and then depression and anxiety they stem off of dementia. As dementia progresses, a patient can become more and more depressed. It is important to do a full assessment of both psychological and social factors that affect the elderly, because the whole everything that affects the elderly affects their well-being, including situations in the family. Oftentimes it's possible that an older adult may live with family members, so then often their problems become the older adult's problems as well. Older adults need to have a very thorough assessment to complete a full interview and understand all aspects of that older adult's life. This can include some socio-demographic data, such as like residential area or marital status, formal education, living arrangements, if they're living with family, or their professional status, if they're retired or if they're still working, their financial status, and then also their functioning assessment of their ability to see, hear, communicate, look after themselves, if they're able to get around independently, and then most importantly, their safety. And through this assessment and interview, the nurse can observe and analyze an older adult's mental capacity as well, and understand if the older adult can make decisions on their own, or if they're fully oriented. And then they can also observe their coping status, whether they're accepting of their situation or if possibly they're withdrawn. Physical health is a big contributor to mental health. Sometimes an older adult may come into the hospital or the doctor's office with some kind of debilitating physical disease that is exacerbated by mental health. Therefore, identifying mental health problems early and seeking consultation and treatment will enhance timely recovery, according to the textbook on page 321. It is important for a nurse to understand everything that influences the older adult's life, whether it be stressors and changes, belief systems, society, everything in that person's life that affects their mental health, which can contribute greatly to whether or not they have depression or anxiety and why. Now, a study was done by Chang and Chen about a controlled group of older adults. And the purpose of the study was trying to correlate physical and mental health status. So they used the following assessment tools to understand each aspect of the older adult's life to determine their mental status. So they used the MMSE cognitive functioning assessment, which explains the orientation, registration, attention, recall, language, the Barthel index of their self-care abilities, of feeding, personal hygiene, toilet use, continence, and mobility, the Cornell depression scale of the mood-related signs, behavioral disturbances, physical signs, and then also the Clifton assessment of their behavioral dysfunctions, if any. So just all of these assessments are of different aspects of the older adult that are important in, exploring to understand the overall health of the individual. And the study really resulted that depression was negatively correlated with mobility and deficits to the person's physical well-being. So some interventions to mental illness can simply be just characteristics associated with resilience. The book explains personality traits and resources that we can instill in the older adult population to help them, such as positivity and optimism, setting goals, high self-esteem, determination, and just an overall sense of purpose in life. And then There are pharmacological interventions such as antidepressant use and antipsychotic drugs and benzodiazepines that can be used in the treatment of depression, dementia, and anxiety. However, it is important for us to recognize that these drugs can have side effects that might reduce functioning ability and activity participation, which oftentimes those are aspects that influence a person's mental health and could be reasons why they are struggling with mental health issues. So, for example, I tell you a story about a state school patient that I had. Um, she wasn't mentally there. She wasn't oriented at all, but she knew she was in a different environment, and, that brings a lot of stressors. So the nurse that I was working with, we would try to enforce some non-pharmacological interventions first prior to starting pharmacological interventions. So we would try positioning or music therapy to make her more comfortable and more relaxed, because we saw that the pharmacological interventions often left her sedated, and we didn't necessarily want that for that patient. So moving on to education, something that I stress throughout this PowerPoint is just that changes in mental health are not a normal part of aging, and they need to be taken seriously. It is important to recognize that mental health is often associated with changes in the life and the body of the individual. So getting a holistic approach and assessment of the older adult is important in treating the mental health. Polypharmacy is a concern in older adults, so non-pharmacological interventions should be used, and they can also be used in conjunction with medications for depression or anxiety. Depression is underdiagnosed and undertreated. However, it is very much can be effectively treated if not neglected. And there is no cure for dementia. However, prompt diagnosis and support can positively influence the outcome of the older adult. So it's just very important for us to be advocates for our family, so that we can accurately treat these mental health disorders along with their physical disorders too.